Welcome and good afternoon, and thank you very much for coming to our book talk, Doctor on Call, Chernobyl Responder, Jewish Refugee, and Radiation Expert. This program is sponsored by the Contra Costa Jewish Community Center and Congregation B'nai Shalom in partnership with Diablo Valley Hadassah. And now to introduce our author, Dr. Alla Shapiro, an MD and a Ph.D. She trained as a pediatric hematologist in Kiev, Ukraine, and was one of the first physician responders to the 1986 Chernobyl nuclear disaster, and headed the field team surveying the medical effects on children in the Chernobyl vicinity. Because of great amount of anti-Semitism in the Soviet Union at the time, 4 generations of her family eventually arrived in the United States, where she relicensed, not an easy process, in pediatric hematology oncology and worked for the federal government. She served as a medical officer, as a member of the Counterterrorism and Emergency Coordination staff for the Center of Drug Evaluation and Research and for the United States Food and Drug Administration, working there until her retirement in 2019. We welcome questions, and I'm sure there'll be a lot. It's a very complex subject about Chernobyl, so please write them down in the chat function at the bottom of your computer screen. And now it is a great pleasure to introduce Dr. Alla Shapiro. Thank you.
Good afternoon, everybody, and thank you so much for such a generous and kind introduction. And I am honored by the invitation that I received from your congregation and an opportunity to have a conversation with you all. My memoir was released on April 26, 2021, in commemoration of the 35th anniversary of the Chernobyl nuclear disaster. The cover slide that, please, first slide, the cover of the book. Each of the images that on the cover reflects one part of the book. And on the left side, you see what you probably think that could be a Mars rover exploration, but it's not. This is the cover that was put above the Unit 4 that exploded on April 26, 1986. And the cover was built to let the particles, to get the wind inside the block to get the particles out. But it was a really false design because nobody thought at that time that the radioactive particles will be spread much easily. The second image is what I call the journey of stateless. And you can see that, or I just will tell you that each family has its own burden to immigrate, but there are so many what common between different families that I thought that I have to describe this experience, which cannot be forgotten. And the last image on the cover, it's what we call strategic national stockpile. This is in our country that holds, that keeps everything that might be needed for to supply the population, the needed population in case of any disaster, radiological, nuclear, or biological or chemical disasters. And the waters of these strategic national stockpiles are strategically located across the country. and it designed the distance design that each needed area would receive the medication or any supply within 24 hours after the disaster hit. I decided to write this book for several reasons. One of my motivation was to share my experience in participating as one of the first responder physicians to the Chernobyl disaster. I wanted to share with the reader untold stories about this catastrophe. Some of the chronicles about Chernobyl, about many serious mistakes that made there. For example, one of the major, there was no government plan to prepare for this disaster. Therefore, there was no coordinated response. And this correlation sounds so obvious to me now, no preparedness for disaster, no proper response. But at international conferences that I attended, I was repeatedly asked, what were medical first responders least prepared for at Chernobyl? And my answer never changed. It was everything. The second motivation was to share my family and other family harrowing journey of immigration from the Soviet Union to the US as stateless refugees. On this journey, we all faced the great unknown, as those who displaced into a different political and cultural environment. For each family, including mine, immigration offered a mixed bag of prospects. Some were exciting, some were like a pervasive, a lingering negative fate. And this, what I want to emphasize, made me feel strongly that the stories and hardships, losses and victories, hopes and dreams should not be forgotten. And the third reason I wanted to write this book was to convey to the reader meaningful and somewhat unique information concerning my work in the US. In my career in this country, I integrated knowledge from the Chernobyl disaster with advanced research conducted in the US and in cooperation with the key international institutions. My position as a medical officer, as Riva mentioned, at Office of Counterterrorism and Emergency Coordination, which always was a conversation stopper, allowed me to participate in development of a new class of pharmaceuticals called medical countermeasures that can be used to prevent or treat health emergencies associated with radiological and nuclear events. So in the next 35 minutes, I'm going to take you on a journey that started for me 37 years ago. I will emphasize what did the world community learn from the Chernobyl disaster and how we apply this knowledge today. It's very clear that we cannot undo the past, but we can learn from that. So I first heard about Chernobyl, the explosion, when my father called me early morning on April 26, 1986, with this dire news that deep in the night at 1:23 a.m., the core of a nuclear reactor had exploded in Pripyat. For many years, my dad has been getting real news about what was going on in the Soviet Union from the Voice of America and BBC. He did not trust the Soviet news, so he always was listening to this radio station, mainly between 3 a.m. and 5 a.m. every night. This is the only time when we were able to receive this unjammed broadcast. So on this slide, you see the city of Pripyat, where the Chernobyl station is located. But because Chernobyl is the largest city, the closer to Pripyat, about 9 miles, then the disaster is called Chernobyl disaster. But the distance between Pripyat and Kiev, capital of Ukraine, at that time with population over 2 million is 60 miles. The Chernobyl accident was the result of a flawed design and was operated by inadequately trained personnel. I did not pay much attention or feel concerned about my father's news at first. Chernobyl was a little-known, nondescript place. It was, and I was, completely uninformed of this nuclear power plant so close to home that would soon propel my life and my career into a whole new sphere. The world was still unaware that parts of the reactor core had exploded like rockets through the atmosphere. Radioactive products were catapulted and spread across the best part of Europe and Northern Hemisphere. On this slide, you see Pripyat, which was built in 1970 and was designed as a model Soviet metropolis, and only was built to house Chernobyl nuclear power plant workers. The authorities repeatedly told people that this city was made just for them. Residents really viewed the city as a paradise. They were enchanted by modern-looking buildings and natural beauty of the landscape. Behind these buildings were rivers and fishing and abundance of berries and mushrooms for picking up in the forest. And then roses and fruits trees were everywhere, and they just completed the image of this heavenly city. Of course, life in this heaven on earth ended on April 26th, when the city woke up facing this catastrophic event. 2 days later, the city was abandoned because of radioactive contamination and placed on the list of ghost towns. After the explosion, the Soviet and Ukrainian governments issued no warnings and repeatedly insisted over public broadcast that life should continue normally. This was a pervasive official response, and it was to deny and mislead the public. And this approach was embraced by those in the highest positions down to the lowest bureaucrats. Thank you. Yeah, you can, okay. So just a couple of minutes without the slides. When reactor 4 exploded, everyone was unprepared and grossly underestimated the force of steam. The roof of the reactor blew off. Helicopter pilots hovered over the burning reactors, dropping steel and dolomite and clay to quench the blaze. Helicopters' crew consisted of pilots who recently returned from Afghanistan. The country was invaded by the Soviets in 1979. The Soviet government officials really made a good calculation. They thought that people who never fought in the war, or as I said, never looked death in the eye, would be afraid to fly over the burning reactor. That's why they chose the helicopter pilots who just returned from Afghanistan. And in their opinion, in the opinion of Soviet government, the pilots would be a good match for this job. And the pilots, the whole operation over open reactor core lasted 2 weeks to put the fire down. And over these 2 weeks, more than 5,000 tons of sand, clay, and lead were dropped into the reactor core to extinguish the fire. The pilots and cameraman received at that time experimental Soviet drug, the name of the drug Indralin, to protect the life of the pilots and cameraman from the deadly doses of radiation. Unfortunately, the drug was not effective, caused serious side effects such as nausea, vomiting, and dramatic changes in blood pressure, and did not protect the pilots. Next slide, please. In parallel with this catastrophic event, other horrific and rated as a suicide event took place around the exploded reactor unit. It was hard to imagine the spread of fear when we became aware of how many pieces of radioactive debris remained on the reactor roof. Even more shocking was to learn that the robots that were sent from Japan that initially used to clear wreckage turned into fried particles. After the robots failed, people were assigned to the task. And I saw this live on TV in Kiev. There were lines of volunteers. All these people who were on the roof, work on the roof, were volunteers, and the commander asked them who would like to volunteer to go on the roof. And every single person took a step forward and decided to be a volunteer. So each volunteer received 2,000 rubles, which equal $35, to work on the reactor roof for 90 seconds only. Risks and long-term consequences of radiation exposure were not mentioned. Dosimeters, which are the devices to measure level of radiation, were confiscated to conceal the true scale of the disaster. For Soviet officials, the fear of panic was greater than fear of radiation. Next slide, please. 36 hours later, the evacuation from Pripyat began. The evacuees were told that they're leaving for 3 days only, and were told to pack their essentials for these 3 days. And this was another betrayal of the Soviet government, who preferred to keep up this pretense of the temporary evacuation. Where did the evacuees go? Most of them arrived in Kiev. Scared passengers from Pripyat and villages were unloaded at the different places in the city and at different times. And then empty vehicles were moved to the center of the city, where, again, without any knowledge of radiation, the drivers and the team were washing the highly contaminated buses with the hoses. And this water, muddy water, was pouring down and accumulated on the asphalt, on the streets, and people, especially children, of course, were very happy that there is some artificial pond there, and they were playing in these muddy waters. And at that time, I worked as a pediatric hematologist in one of the largest hospitals in Kiev, and a few weeks later, I became a team leader of so-called field team that we were one of the first responders at Chernobyl, and we were dispatched to the emerging nuclear nightmare. There was no any information from the Soviet government about the disaster and how to cope with this. I was asked by my supervisor to go to the library, and this was premier library, scientific library in Kiev, to get basic information to make a presentation for the doctors and nurses at our hospital. I went to that library and I just could not believe that I looked at the empty shelves. There was no books, there were no journals. I asked the librarian, where can I get some books about the radiation? And she looked at me and honestly said that they received the order from the above to take all the books and journals, all the articles contain the word radiation. And this is how, again, Soviet government lied to population and pretend that nothing is happening. But of course, the population of Kiev and vicinity learn about protection from radiation through rumors. And rumors spread very quickly, maybe even faster than radiation sometimes. And first people started thinking, including my family, to evacuate their children. My daughter was 3 years old at that time, and we wanted to send her away, but we didn't know where is the clean place. So very soon after the explosion, some scientists managed to gain an access to the true numbers that reflect the degree and scope of the radioactive contamination. They put together this map that was, of course, illegal at that time to tell the population what's going on. But I was lucky that in the apartment building where my family lived, one of the neighbors worked at the Institute of Physics. He was a Ph.D. and he smuggled this map, a copy of this map, and brought to our apartment building. So we had a couple of close friends in our apartment building. And having grown in the Soviet Union, everyone feared that authorities would follow them, listen to the conversation, or even put us to jail. So again, we grew up mainly on spy movies, and spy movies every time would tell you that you close the drapes that was portrayed in the movie, you unplug your landline, and this way the KGB agent won't be able to listen to you. So we did exactly what we learned from the spy movies, and we just hovered above this map, and you can see that colors of the map come from angry red to just soothing yellow and pink. And we immediately realized that Kiev was a hotspot. Next slide, please. This slide reflects the evacuation from Kiev. My parents compared this day in May of 1986 with the evacuation from Kiev during the World War II that they went through. And this is, again, how moments in history repeat themselves. And on that day, we were trying to protect our children from something as dire as war, and this was the nuclear catastrophe. So we took our daughter to the train to say goodbye. We chose the city of Kharkiv, where luckily one of relatives lived, and she offered that my family, my daughter with grandmother, will go there and stay there indefinitely as long as needed. So the train was waiting on the platform, and as always, we moved to the ticketed seat numbers. there is always a way, and they are in every country, that there is a strict check prior to every train departure. But on that day, all the prior to departure rules were ignored, and access to the train was uncontrolled. The windows and doors of the carriages were opened, and parents who did not have tickets, because to get tickets, it was a big problem. All tickets were sold out, either train or airplane tickets, including black market. It took us 5 days. We put our daughter on lockdown at home, and took us 5 days to get tickets to this city. So because windows stayed open, parents who did not have tickets but frantically wanted their children to get out of the contaminated city of Kiev, they were handing their children to the strangers through open windows and through the open doors, begging them to take their children to the secure place. And when I walked in with my daughter to put her on her designated seat, then I saw that on each seat, each bench, there were at least 1 or 2 children from 4 to 15 years old, 15 years old, unaccompanied by adults. And this was everybody who saw that, who witnessed that, just felt the enormous pain and anxiety surrounding each separation of the child from the adults. Next slide, please. There are many health consequences related to Chernobyl accident. And for several years after the accident, attention of scientists and doctors were directed towards studying the increased incidence of cancers in people who were first responders or who continued to live into the contaminated areas other than Chernobyl, or who were evacuated from the highly contaminated areas to the clean areas. And the psychological consequences have not been mentioned. In 2005, I attended a conference in Geneva where the international community got together to discuss health effects of radiation. And then I was so surprised when I saw this introductory poster. Please, I will give you a couple of seconds to read this statement. So the main psychological consequences of the Chernobyl disaster were anxiety and depression, cause and suicide by relocation of large group of people, including children and adults. And these people who were evacuated, they lost their homes, their friends, and their jobs. And this now, going through COVID disaster, there are so many similarities between all the disasters, and this psychological impact is one of them. And we need to remember this. New disaster will come. We don't know when and where, but this will be something that will follow the psychological impact, especially on vulnerable population that we need. And vulnerable population are elderly people, children, and people with different chronic or acute diseases. And we need to remember about that and not fall under the diagnosis, which is now disaster amnesia. It's not the official diagnosis yet, but maybe it will be. And this tells us that people who went through the disaster, they tend to forget it instead of, learning things from the disaster. There were lots of studies that would on long-term psychological effects on children and their parents who were evacuated. And the results from these studies were pretty interesting. Again, we're focusing on children, that they will be the most vulnerable, but in Chernobyl situation, the mothers showed more signs of depression and anxiety than their children. And the hypothesis was that the children were buffered from their mother's chronic anxiety and maternal belief that radiation will harm them. So children, these thoughts were pervasive in mothers, but they did not reach children. Next slide, please. Well, this is, I know it's everyone's favorite, so people who are falling asleep listening to me will wake up looking at this. So I was, as I mentioned, a struggle to help pediatric patients, but medical personnel in the adult hospitals were so experienced such an overflow of adults from contaminated area that they asked pediatricians to help them. And I was just randomly one of them. And many pediatricians, including myself, had not examined or treated adults since medical school. And it's quite different. If you used to treat a child, you will tell some funny story about, animals, and child will just be yours. But with the adults, it's different. It's not working. So I was one of these non-certified internal medicine adult doctors who came to the adult hospital. And my first visit was really memorable. So I entered the room with 8 men. That's how big. This was not the largest room in hospital in Kiev. Sometimes it was 12 to 16 patients, but this one was kind of small, only 8 men. All were former workers from the Chernobyl nuclear power station who were admitted to the hospital for evaluation and treatment as needed. They all were middle-aged men, and they looked tired and reluctant to talk. And I walked in, nobody even turned their head, except one man who was in the corner bed, and he was waving with some papers and kind of inviting smile. So when I approached him, my patient handed me the workplace protocols, and he said to me, "This is our manual, which we had on the nuclear power station in Chernobyl, and we had to read and learn even before we accept our jobs, and of course be aware of that when we are working." And he said, my favorite or our favorite recommendation is that in case of emergency, we should, and he looked at me as a dreamer and then added, we should drink red wine. So this was an eye-opening to me, and I tried not to laugh, and then I would just politely said, "Could you please show me on which page I just want to see it?" And his answer really shocked me. He said, "After the accident, we were told to rip the page with the red wine from the manual." But I stopped this conversation, but his answer continued to bother me. So I got home, I mobilized 4 generations of my family to go to the grocery store and buy as many cases as red wine as my family members would carry. We entered the store and were stunned to find empty wine shelves staring back at us. So we looked at each other and disbelief. And again, this was a proof that rumors spread as fast as radiation. There was all wine was already bought. But fast forward, currently scientists in the United States are investigating a component called resveratrol, which is present in red wine. If approved, this drug might protect human cells from harmful effects of radiation, but it's in the stage of development. And I had a pleasure to talk to the investigator of this drug. And I asked, and how many bottles of red wine person has to drink if just to mimic the concentration in the pill? So he said, well, person should drink 720 bottles of wine to match the results of this component. And as you probably agree, by that time, the person wouldn't care not only about radiation, but about anything. So for 3 years after Chernobyl disaster, I continued to take care of pediatric patients who were evacuated from the dangerous zone. And then 3 years after, my family and I left the country. Thank you. You can put the slide down and I will quickly talk about what is in part 2 in my book. It's a journey of my family and other stateless refugees to the United States. And my family immigrated because of the couple of reasons. The first one was the deep roots of anguish that caused my family to pack up our lives and leave. And this grew from years of experience, open hostility toward Jews in the Soviet Union, and discrimination and persecution of Jewish people were simply a matter of government policy. And government encouraged the open expression of anti-Semitism. In addition, it was impossible to get the desirable job, even if a Jewish person met all the credentials and all the requirements. And Jews were a group of people that were blamed for everything what happened. And the last straw was the bureaucratic lies and cover-ups in the aftermath of Chernobyl accident. And this was the last straw. My family and I fled the Soviet Union. And I will continue the immigration route of 4 generations of my family. And it was a brutally hot summer of 1989. And there were 7 of us, which I called the Magnificent 7. My daughter was the youngest. She was 6 years old at that time. And the oldest was my grandmother, who was 88. As immigrants, each of us was allowed to carry with us 40 pounds of possessions and 99 in cash. We, as a diverse group of refugees, we traveled from USSR to Austria, usually for a short stay. It was the mandatory path at that time. There were no direct flights or opportunity to go from Soviet Union to the US. So after short stay in Austria, it's usually in Vienna between 6 to 10 days, we went to Italy as the second destination before, hopefully before the US, where we were stranded for 6 months. It was an unexpected time period. We belonged nowhere. We didn't have any papers, and none of us knew if we would ever arrive to the United States. During their stay in Italy, Soviet Jewish refugees added stories of their courage and resilience and hope. And next slide, please. So our stay in Italy is just I give you a little taste of Italy. I don't have time to describe each image. Hopefully, everything is in the book, but I just don't have time to talk about this. So we stayed in Santa Marinella. It's a picturesque suburb of Rome, but I would never call our stay in Italy Roman holidays. The apartment of 7 of us reminded of a small train. However, it didn't have either windows or doors. Instead, you see sheets or light curtains that separated space between the rooms, and many obviously private conversations where who is who in the family were really public conversations. And then Soviet refugees spent months and months without income or any meaningful way to be productive as they awaited permission to get to the United States. Therefore, each family prepared for this stage and carried some popular items for sale. And there was a market. It doesn't exist now. It was in suburbs of Rome, and the name of the market was Americana. And this was in honor of the Soviet refugees who were selling things there before they went to the United States. And just one quick, again, sorry, I don't have time to go over this, but for example, Cuban cigars, they were in a high demand in America at that time because US broke their ties with Cuba in 1961. So Americans did not have a pleasure or aroma of this finest cigar. So former Soviets were well aware of that, and they did not need to have Ph.D. in math to calculate that each cigar that cost 4 cents, 2 rubles, or 4 cents in the Soviet Union, in the Americana was the cost was $15. So another was with very little money. We didn't have money even to get on the bus, so hitchhiking was a wonderful solution. And informal, but what we call hitchhiker's guide circulated among the refugees. So the mothers, preferably blonde, and their daughters made a perfect combination. So a young lady wearing heels will find the area where lots of bushes. So her family, her husband, fathers, brothers would hide in this waiting area. And then the car will stop, and driver will politely say "Prego, Signora," and then Signora would just call everybody from the bushes. They rushed and got in the car and went to desired destination. So when last touch of Italy, why did we stay in thousands of families, 6,000 to 7,000 of families were stuck in Italy without permission to go to the United States? The problem was that previously, before 1989, Jews from the Soviet Union were presumed to be political refugees, and they did not have to provide compelling evidence that they have been persecuted in Soviet Union. However, the problem that US government did not anticipate that so many refugees will come from the Soviet Union that they did not have money to host them. So that's why there was a new rule that they have to provide, each family has to provide compelling evidence that they were persecuted. And even after that, there was no positive solution and to entry the United States. So this situation changed in November of 1989, that lots of leaders of Jewish community and government protested, and responding to this pressure from American Jewish community, Congress passed so-called Lautenberg Amendment, which stated that each Soviet Jew immigrant potentially will consider refugee and qualify for refugee status. That's how my family and it happened in November, but there were 6,000 to 7,000 people, refugees. So our turn came in December, and my family left Italy in December of 1989. And I think 5 minutes is okay. Please tell me. I'll be done in 5 minutes. So this is part 3 of my book. Our family received an extremely warm welcome from the Jewish community when we arrived to Washington. We made friends in a couple of weeks, and quite few of them still our best friends today. The welcome we received took some fears off my mind, although plenty remain: not having a job, not having credential to practice medicine here, taking care of my daughter, my elderly mother and grandmother, all contributed to anxiety and uncertainty. However, despite of not such a bright beginning, and the later during the darkest month of my life, I never doubted my decision to come to the United States. And we consider Maryland our home right from the moment the airplane touched the ground in Washington, and never ever I felt that I would like to leave Washington. So the road for me to become a doctor again was not easy: relicensing, recertification, and I became doctor again with all the credentials. And unfortunately, I don't have time to open this next slide, please, which calls forever red door. If you have a question, I will answer, but I have to move to not to go over time. So please go to our next slide. So this was what this job that I dedicated 17 years of my life. The Office of Counterterrorism was opened after September 11. It did not exist at the Food and Drug Administration, or never ever else before that. And after September 11, this office was open and had and still exists and has a specific role, which is to provide advice to pharmaceutical, biotech companies and academia on how to develop drugs against drugs against radiation. And it includes radiation damage to humans from nuclear bomb explosion, radiation accidents, terrorist attacks, or nuclear power stations, accidents at the nuclear power station. And another mission statement of our office was to make sure that the public and the healthcare community have timely access to these products. And what been used in 2002 to develop these drugs against radiation, it's so-called animal rule. When any drug that you can imagine is being developed, patients will receive the drug and then the control arm, and then we'll compare. We can, because patients are sick and they receive the proper drug. In case of radiation or chemical exposure, we cannot use the same tactical approach because we cannot subject humans to deadly levels of radiation in order to test the drug. So that's why FDA in 2002 came with the so-called animal rule, when all these, when animals would be subjected to lethal doses of radiation, first small animals like mice or rats, and then if this drug shows an effect on little animals, small animals, then large animals and monkey, mostly monkey, will be a second level of testing. And a group of healthy volunteers will receive the drug without just being healthy to test whether the drug is safe. But it's not the effectiveness on animals, but safety features on humans. And this is what we call animal rule. And this job was a fulfillment of my dream. And I carried this dream since Chernobyl, which is how to protect people from accidental and intentional radiation exposure. 3 years ago, I retired from the FDA. However, my passion continued to develop, and I work for 2 pharmaceutical companies, one international, one American, that are developing drugs against radiation. And the last touch in my book, I ordered this few chapters after after the coronavirus hit. I was not, of course, planning to put it in the book, but in mid-February of 2020, the novel virus reshaped daily life of the entire world, and my publisher asked me if I could write a few more chapters to uncover similarities between the Chernobyl and COVID disaster and how remembering the past help us to protect the future. So thank you very much for your attention. And this completes my presentation.
Well, it's a fascinating, very fascinating story that you told to a very tragic disaster in Chernobyl. Please, everyone, if you have questions, put them in the chat. So regarding COVID, do you think we were told everything, or is it more like Chernobyl?
Unfortunately, it was not very close, but it was very similar to Chernobyl. It's not just the part that we were not told the truth. I think the most disturbing that we were not prepared. And this is connected. If we were prepared for this disaster, then it probably wouldn't make sense to hide things, but we were absolutely unprepared with our knowledge, without supply from that strategic national stockpile that I proudly referred to. But I was talking, in my case, only about radiation supply at the strategic national stockpile. Of course, I was unaware until the disaster came that we really did not have needed supply.
Does anyone have any questions? Yes, Joanne, just shout it out.
Thank you. Are you still in contact with any of your friends from the Ukraine and what they're going through right now?
Yeah, I am in contact with my former neighbor. We used to live in the same apartment building with him. And he and his wife just moved to a building very close to where we used to live. So yeah, we are frequently, I talk with him maybe a couple of times, couple of times a week, but you know, each opinion, again, the big problem that I don't know who can I trust, because the information about what's going on, what the response is so controversial that Russian channels would tell you one thing, Ukrainian channels tell you different thing. American, you read totally opposite. So it should not be like that. But yes, I'm in touch with him, and 2 days ago, my neighbor was watching how this Patriot missile defense was sent to kill these Kinjal missiles, and they stop going into the hiding. They just stay home and they're watching this because people cannot live like this anymore. It's been almost a year and a half. Yeah, please.
Yes, Joanne, you have another question.
Has there been a big upsurge in cancer from the Chernobyl event?
Yes,
there has been. Okay.
it was. Yes, it was. The numbers, well, I have to always start with this. When I hear this question, of course, it's a very reasonable question. The studies on cancers are still ongoing. Again, different labs, different data, but what is true about thyroid cancer raised dramatically, especially in children. And it started relatively early after the exposure, after the disaster, because the other cancers, they're late effects of radiation, and they would show after 15 or 20 years. But thyroid cancer started in children 10 years after. And the known and well-proved reason that children did not receive protection with potassium iodide. There were pills everywhere, there were liquids, and potassium iodide is 100% protection for thyroid gland, not any other organ, just thyroid gland. And children did not receive this. Even population in Pripyat, they were offered this, maybe 30% of population, but children in Kiev and other places received the recommendation from the government, not from the physician, to start this 10 or 14 days after, which is absolutely useless. To be effective, potassium iodide must be given in first 6, maximum 12 hours after the radiation. And we officially, even me, first responder, received this order 14 days after. And this was the first time when Gorbachev publicly showed up on TV and told the whole country, we had disaster, but everything is under control, everything behind us. That's what he said, which again was another lie, because everything was just in front of us.
In the United States, do we have enough of potassium iodide in case something happens?
Yeah. Don't worry, enough supply, perfect guidance. I am saying that not because I was part of creating this guidance when I was at the FDA, but there is enough supply in strategic national stockpile, and government will be responsible. You don't have to keep it at home, but government will be responsible to move the necessary amount of potassium iodine and give all the instruction for kids. One dose is for adults different. Yes, this is fine.
For
Your
You know,
family,
Joanne,
your family is okay, your children are okay?
Yeah, thank you. My daughter, my daughter is good. I had a colon cancer 11 years ago, which is most common late consequences, the most common cancer in women, the late consequences of late effects of radiation. But I was cured in
Good.
the United States, and yeah, thank you.
Very talented woman. It's amazing what you have accomplished. We're so glad you're in the United States now.
Yeah, me too. Very glad too. Yeah.
well, we want to thank you. For those of you who have the book or going to buy the book, Alla is willing to sign a book plate. So email me, rivagambert@gmail.com. And Claire, could you write that in the chat? Thank you. And put your address, and then I will contact Alla Shapiro. Thank you, Alla, so much. It was a fascinating story. It's a fascinating book. It's an important book, and we wish you all the best.
Thank you
And
very much for your attention. I think I kept myself within the frame.
no,
you
it was
know.
excellent. It was excellent. And
Usually I ask how many days do I have to tell my stories, but I know
but
that
you
it's
did
not the case.
an excellent job on a difficult subject, which I hope for many decades or even centuries we don't have to face again. And to your friends in Ukraine, our heartfelt wishes for
Thank you.
a good
Thank you very much.
end to
I appreciate your attention and questions, and wishing you all the best.
Thank you so much. Bye, everyone, and an early wishing everyone a happy Shavua.
Bye.
That's next week.
Bye.
A lot of cheesecake.
Thank you.
Bye.